Here we go. Mic check 1 2 1 2. Y'all, I'm Dr. Naeema Burgess, straight out of New York, by way of North Carolina, Brown Summit, North Carolina, country girl, but turned New York City girl. Um, I'm definitely I have a podcast, and a new portion to my podcast is Neuro Insights with Dr. Naeema Burgess. And every week, each month for 3 weeks, I'm going to be given a series on different topics, and then the last talk will be a question and answer. So if you have questions, let me know what your questions are. Any things that you want to be discussed, let me know. If anything you want me to dive into, let me know. I'm that girl, y'all. So welcome, and first and foremost, wait, let me give honor and glory to God because I am supposed to be a statistic. I'm a young Black girl raised in a single parent household in the South, where my mama made $11,000 a year. And I was able to go to God is so good, y'all. I'm gonna get excited. I'm getting like, whoo, you know, emotional. God allowed me to be here. God created this for me. God created this in me so that I can give me to you, um with all of my insight, my knowledge, my awareness. So want to give honor and glory to God because without him I wouldn't be here giving you guys this me. So let's jump into it. So welcome to the very first episode of Neuro Insights with Dr. Naeema Burgess. That's me, your girl. I am a clinical triple board certified psychologist, so clinical school neuropsychologist. And today we're diving into one of the most widely recognized yet often misunderstood conditions in the neuropsychological world: attention deficit hyperactivity disorder, better known as ADHD. And your girl, me, I have ADHD. Whether you're a parent, educator, or just someone curious about ADHD, understanding its core symptoms, diagnostic criteria, and common myths versus facts is key to navigating this condition effectively. And this is a talk that you might want to hear. So let's start at the very beginning. What is ADHD? ADHD and its symptoms, the types and diagnostic criteria. ADHD is a neurodevelopmental disorder that affects how individuals focus, control or lack thereof their impulses, and regulate their energy. It's not just about being hyper or easily distracted, there's much more to it. ADHD is typically diagnosed in childhood, but its symptoms can persist into adulthood. So sometimes we see people in adulthood who haven't been diagnosed as a child, but in order to get the diagnosis of ADHD, you have to have had symptoms before the age of 12, okay? If you see symptoms as an adult and you didn't have the symptoms as a child, it could be something else like anxiety or depression. The core symptoms of ADHD fall into three main categories: inattention, hyperactivity, and impulsivity. So let's break each down. Inattention can manifest as difficulty sustaining focus, being easily distracted, and often making careless mistakes in schoolwork or tasks. Children may have trouble following instructions and completing tasks, particularly those that require sustained mental effort. As a parent, you may notice yourself getting frustrated working with these babies. And I want to tell you to give yourself grace. That's one. And two, I want to tell you that you're not alone. It can be very challenging, but make sure you pace yourself and fall back a little bit. You might need to take a break. You might need to take a break from helping your child with a task because you don't want to um, present a lot of anger and frustration to your child. They're dealing with the disorder, and it may be diagnosed or not, but 9 times out of 10, if they're dealing with that, you yelling at them, being frustrated with them all the time can impact them negatively, and that's not what you want, okay? Another is hyperactivity, and that's characterized by excessive fidgeting, talking, or moving around. Children with hyperactivity may struggle to stay seated, talk excessively, or interrupt others. It's often described as an internal restlessness. And impulsivity. This refers to acting out without thinking or acting without thinking. It might look like interrupting others in conversation, making snap decisions, or struggling to wait one's turn in various settings, such as school, work, or home. Now, ADHD isn't a one size fits all diagnosis. There are three main types of ADHD based on which symptoms are most pronounced. ADHD inattentive type, where inattention is the primary issue, but hyperactivity and impulsivity are less of a concern. Then there's ADHD hyperactive, or the impulsive type, where hyperactivity and impulsivity dominate, but attention difficulties may not be as significant. Lastly, there's ADHD combined type, where both inattention and hyperactivity or impulsivity are present in significant ways. The diagnostic criteria for ADHD are outlined by the Diagnostic and Statistical Manual of Mental Disorders, and that's the DSM. That's how we diagnose. That's like our mental health Bible. The symptoms must persist for at least 6 months. The symptoms must be present in two or more settings like home, school, work. The symptoms must negatively affect the individual's social, academic, or occupational functioning. It's important to note that the symptoms must not be better explained by other conditions such as anxiety, depression, or learning disabilities. Um, there are other medical challenges as well that can resemble ADHD, so be mindful of that as well. ADHD is often diagnosed after comprehensive evaluation, which includes interviews, questionnaires, and neuropsychological testing. It can be extensive, very extensive, but it's very well worth it. So let's get into some common myths versus facts about ADHD. And take a moment. Let's just think about this. Think about this in terms of things you've heard in your family, things you've said yourself. So here's one myth: ADHD is just an excuse for bad behavior. I've heard this many times. The fact is, ADHD is a legitimate neurodevelopmental disorder. It's not about poor parenting or being undisciplined. The symptoms of ADHD are rooted in differences in brain function. Hi, Jeffrey, particularly in areas related to attention, impulse control, and executive functioning. It's not about willpower, it's about how the brain processes information. Here's another myth: children with ADHD are hyper and can't sit still. Well, the fact is, while hyperactivity is a hallmark symptom for some children with ADHD, not all children with ADHD exhibit hyperactivity. Many children, particularly those with the inattentive type, are not overly hyperactive. And you will see a lot of young girls that exhibit this if they get a diagnosis. Instead, they may be quiet and daydreamy, often overlooked because their struggles are more internal. Myth number three: ADHD is just a childhood disorder. People grow out of it. I mean, you can. However, the fact is, while ADHD is often diagnosed in childhood, it can persist into adolescence and adulthood. In fact, studies show that approximately 60% of children with ADHD continue to experience symptoms as adults. And honestly, I didn't get diagnosed with ADHD until I was in my 30s. Um, and that just meant that I had more challenges as an adult with ADHD than as a child. The presentation may change over time, but difficulties with attention, focus, and impulse control often remain. Myth number four, and I'm going to only give five today: ADHD is caused by sugar or poor diet. The fact is, there's no scientific evidence linking ADHD directly to sugar intake or poor diet. While nutrition is very important for overall health, ADHD is primarily a neurobiological condition. Genetics and brain structure differences play a role, far more significant role in this development. Okay? The last myth that I'm going to give is medication is the only way to treat ADHD. The fact is, while medication is a common and effective treatment, for many individuals with ADHD, it's not the only option. There's behavioral therapy, Parent training, environmental modifications like creating routines, educational supports can also be effective treatment. And one of my favorite is neurofeedback. It's emerging as an adjunctive treatment option. And neurofeedback, we're going to give more information later on, but thank you, cousin. Neurofeedback is brain training. It's like going into the gym and working the exact muscles that need to be worked in order to enhance those areas of the brain. Lastly, the different parts Lastly, the differences in presentation between children and adults. ADHD looks different in children and adults. While many symptoms are the same, the way they manifest can vary significantly due to developmental stages and life circumstances. In children, ADHD often presents as difficulty staying on task, completing schoolwork, and behaving appropriately in classroom settings. And I know you guys know some of these children. Parents may notice issues with impulsivity, like interrupting others or having trouble waiting for their turn in line. Hyperactivity can look like excessive talking, moving, or trouble remaining seated during class or meals. For adults, ADHD can be less visible to others, but the challenges are just as significant. The core symptoms of inattention and impulsivity can manifest as difficulties with time management, staying organized, or following through on tasks at work. Adults with ADHD may also struggle with procrastination, losing items frequently, or having difficulty maintaining relationships due to impulsive behaviors or poor communication. We're going to get into some supports for these areas if you stay tuned for the season of these talks. It's important to remember that ADHD goes unrecognized in adults, especially in women, because symptoms may not match the more traditional hyperactive profile that we associate with children. As a result, adults with ADHD may seek help for related issues such as anxiety or depression, low self esteem, not realizing that it's ADHD. I do have a lot of people coming into the office that we then find out that it's not because of anxiety. It's not the anxiety is caused because of ADHD, or the depression is onset by ADHD. But we do a comprehensive evaluation to really understand the root of what's happening. What are these symptoms? Where are they coming from? In order to create the best treatment plan for that person. Um, ADHD is sometimes the contributing factor. In conclusion, what can we take away from today's discussion? ADHD is a complex neurodevelopmental disorder that affects individuals differently based on their age, environment, and the specific type of ADHD that they have. Recognizing the signs early and addressing common myths and understanding the differences between how ADHD persists in children and adults are crucial steps toward better management and support. If you or someone you know is struggling with symptoms of ADHD, remember that there is help. Help is available for you or them. Comprehensive evaluations from a neuropsychologist can be a critical first step in creating an individualized treatment plan. And I'm your girl. You can reach out to me, please, and thank you. Or I can definitely refer you to someone in your area. In our next episode, we'll explore how ADHD impacts the family dynamic and how parents can create strategies to support their child. I'm excited to continue this conversation with you. Thank you so much for your time. Thank you for tuning in to Neuro Insights with Dr. Naeema Burgess. If you found this episode helpful, don't forget to subscribe, share, and leave a review. Listen, supportive, fruitful, productive reviews, please and thank you. I'd love to hear your thoughts and questions about ADHD. Until next time, stay informed and take care. Make sure you follow us at Giving Hope LLC. Thank you. Be blessed and continue to be a blessing.